Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we will look at how to use neuromuscular electrical stimulation, NMES, to produce muscle contractions and improve strength. NMES is used to produce a motor level response, meaning a visible muscle contraction. It is commonly used for strengthening and neuromuscular reeducation. If a patient cannot make a sufficient volitional contraction, then NMES is appropriate and can improve strength. It should be initiated within approximately 6 weeks after injury or surgery and dosed to achieve a strong contraction. When NMES appears ineffective, it is often due to poor dosing, focusing on outcomes other than strength, or applying it too late. A key point here: Russian and NMES are not the same. NMES describes the treatment goal, producing a muscle contraction to improve strength. It can be achieved using either pulsed current or alternating current. Russian current is simply the alternating current waveform used to achieve that goal. Next, we'll look at the NMES settings. Now remember, we can organize these settings using the FIT framework. This framework helps us make sense of the parameters, even though in the clinic we may adjust them in a different order based on the treatment goal. So let's review each part. Frequency refers to the pulse or carrier frequency and is measured in pulses per second, or hertz. Intensity is the amplitude, measured in milliamps. Time refers to pulse or cycle duration, measured in microseconds. And type is where we make our clinical decision. Are we targeting sensory or motor stimulation? And which current and waveform will best achieve that? Let's apply this as we would in the clinic. In practice, we start with the treatment goal, or type. In this case, we want NMES, with the goal being a motor level response, meaning a strong visible muscle contraction. Next, we select the current, either pulsed or alternating, as the current choice guides the remaining settings. Keep in mind your device may use different terms for pulsed or alternating current, such as Russian, TENS, or symmetrical biphasic. Let's move on to frequency. This graph shows how frequency affects force production. At lower frequencies, the muscle produces individual twitches, resulting in a weak contraction. As we increase the frequency to between 50 and 80 pulses per second, or hertz, force production is optimized. If the frequency is increased beyond this range, force production decreases. This is likely due to the nerve's inability to repeatedly depolarize at very high rates. Here's an important concept to understand. Time, or duration, is typically set between 200 and 600 microseconds. Longer durations deliver more energy with each pulse or burst. Because of this, less intensity is needed to achieve the same level of muscle contraction, and using a lower intensity may improve patient comfort and reduce pain. Let's walk through that on the next 2 slides. So, why are longer durations preferred? Let's walk through this together. First, I set the duration to 100 microseconds. Now I start turning up the amplitude, higher and higher, until I finally see a contraction. At this shorter duration, it takes more intensity to get there. With that in mind, let's increase the duration to 400 microseconds. And again, I start increasing the amplitude until I see a contraction. This time I reach that contraction at a lower amplitude. That's because a longer duration delivers more energy with each pulse. So even though the amplitude is lower, the total energy delivered is similar. This is going to be more comfortable for the patient and allow for an improved therapeutic effect. Let's take a look at intensity, or amplitude. It is a key driver of force production with NMES. As intensity increases, force production also increases, up to a point. Because of this, intensity should be set as high as the patient can tolerate to achieve a strong muscle contraction. Keep in mind this will vary from patient to patient. If the intensity is too low, we won't achieve overload. But if it's too high, it may become painful and actually reduce effectiveness. To summarize this, for frequency, we should set between 50 and 80 pulses per second, or hertz, to achieve a strong sustained contraction. Intensity should be set as high as the patient can tolerate, aiming to produce a strong muscle contraction. The duration should be high, at least 200 microseconds. For type, we are targeting a motor level response, and that can be achieved using either pulsed or alternating current. Let's look at pulsed current first. Starting with type, the goal is a motor response, meaning a strong visible muscle contraction. And in this case, we are choosing pulsed current. This is where things differ from alternating current. With pulsed current, we can directly set both the frequency and the duration. The frequency is typically set between 50 and 80 pulses per second, which is ideal for force production. The duration is also set directly, usually between 200 and 600 microseconds. Okay, let's move on to setting up NMES using alternating current. As I mentioned earlier, when most people hear NMES, they often think of Russian current, and vice versa. Russian current is a burst-modulated form of alternating current used for NMES. Starting with type, the goal is a motor response, meaning a strong visible muscle contraction. And in this case, we are choosing alternating current. Now, remember, this is where things start to differ from pulse current. The frequency for alternating current is the carrier frequency, and since it is burst modulated in 50 bursts per second, that is our frequency. That is right in the ideal range of 50 to 80 pulses per second, or hertz that we discussed in the NMES settings. Also, we need to remember that with alternating current, we do not set the duration directly. Instead, the cycle duration is determined by the carrier frequency. Here, Russian has a carrier frequency of 2500 Hz. So we can calculate the duration using 1 divided by the carrier frequency. So 1 divided by 2500 gives us 400 microseconds. Again, that is within the ideal range of 200 to 600 microseconds we discussed in the NMES settings. Let's wrap up the fit by talking about intensity. For both pulsed and alternating current, intensity should be set as high as the patient can tolerate. The goal is a strong, visible muscle contraction. However, it should not be painful to the point that it limits the treatment. Intensity will vary from patient to patient, and even from session to session, so it should always be adjusted based on patient response. Now, one key difference is control. With pulse current, we have more precise control over the settings, which often allows for stronger contractions and improved comfort. Before we finish, it's important to recognize that additional settings influence how NMES is delivered. These include electrode placement, ramp time, duty cycle, and overall treatment duration. We're not going to go into detail on those here. Instead, I've created a separate lesson that walks through each step by step and how they impact treatment. So if you want to build on what we covered today, I'd recommend checking out that lesson next. That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.